Wel, prynawn da, croeso mawr I chi gyd. Thank you for joining me again at this first Welsh Government press conference since the election. It is a privilege to serve as your First Minister again and to continue the work we have done together to guide Wales through the pandemic and into the recovery. This week has seen the culmination of the latest three-week review of the coronavirus regulations. And I want to begin, as usual at these press conferences, by setting out the public health situation and the good news that it continues to be positive here in Wales. Rates of coronavirus remain very low, thanks to everything we have done together. The overall rate in Wales is less than 10 cases per 100,000 of the population, and our positivity rate is below 1%. The number of people in hospital with COVID is at its lowest level since the start of the pandemic more than 15 months ago, and today there are just 3 people with coronavirus in critical care in Welsh hospitals. Our NHS is returning to more normal levels of activity for the time of year, treating more people with a wider range of illnesses, injuries and health needs. And thankfully, far fewer deaths are being reported every day. As we start this new term, however, I want to pause for a moment, as we have done before, to remember all of those who have lost a loved one to this awful virus and for whom the future will never be the same. Now, over this weekend, we will reach the 2 million first dose milestone in Wales. That means 2 million of our adults have already said yes to vaccination. This is a truly incredible achievement in the 6 months since the first COVID vaccine became available. And it's all down, as you know, to the dedication and the hard work of all those NHS staff, volunteers and military personnel working in clinics all over Wales. It's due to their efforts and the fantastic response to vaccination that we have one of the very best vaccination rates in the whole of the world. This slide shows you in more detail just how well our vaccination programme is performing. Take-up amongst care home residents, people aged over 80 and people in their 70s, is higher than 90% for both first and second doses. More than half of people in their 30s and well over a third of people in the 18 to 29 age range have now had their first dose in Wales. And over the next few weeks, we will accelerate still further our programme of first dose vaccinations as other parts of the UK make progress to the levels of second doses we have already achieved in Wales. We remain on target to offer all eligible adults vaccination by the middle of July, and if vaccine supplies allows us to move faster, then we know that we can and we will. Now, all of this is very positive and it gives us the headroom to carry on relaxing restrictions here in Wales. We will move to alert level 2 on Monday next. And before I say a bit more about what that means in detail and what we will be considering at the next review, I just want to say a few words about the India variant of the virus that has been so much in the news over the last 24 hours. This pandemic continues to be full of unpleasant twists and turns. We are closely monitoring the India variant, which has caused 26 cases in Wales, but more than 1,500 across our border in England. This new variant appears to spread easily from person to person, just like the Kent variant, which is now widespread in the UK, but it may travel even faster. It's really important that we continue to do everything we can to keep levels of the virus as low as we can in Wales. as we continue to relax restrictions in our careful, step-by-step and cautious way. The UK SAGE Committee met yesterday to discuss the India variant, and we will follow the latest scientific advice just as we have throughout the pandemic. Let me turn now to details of the results of the 3-week review. So on Monday next week, as you can see on the slide, we will move to alert level 2, meaning that indoor hospitality will reopen for groups of 6 people from up to 6 households. Holiday accommodation can reopen fully. Entertainment venues will be able to reopen, and that includes cinemas, bingo halls, bowling alleys, indoor play centres and areas, casinos, amusement arcades, theatres and concert halls. Indoor visitor attractions can reopen, and up to 30 people will be able to take part in organised indoor activities and up to 50 people in organised activities outdoors. And that includes wedding receptions and funeral wakes. On Monday, the 24th of May, we will lift restrictions on the overall number of indoor visitors for people living in care homes. The next 3-week review will be held at the start of June. If the public health situation remains positive, we will look at whether we can move to alert level 1. And that will include looking at relaxing the rules further around people meeting in their own homes, increasing the number of people able to attend wedding receptions, and restarting larger events. And that will build on the experience of our pilot event programme, which began yesterday. On Monday next as well, international travel will resume in England and Scotland and will restart for people in Wales. We will use the same traffic light system for international travel as other parts of the UK. This lets people know what the quarantine and testing arrangements are when they come home. Now, it is really important that we continue to do everything we can to prevent coronavirus re-entering Wales as a result of international travel. Because of that, everyone returning from a green list country will have to book and pay for a test on their return. And all travellers and household members will be reminded about the availability and use of additional lateral flow tests so that they can follow up that first test at home and make sure that they are keeping themselves and others safe. Here in Wales, we will not adopt the English test to release scheme for travellers returning from amber list countries. And that is because the evidence that we have is that around a third of people who develop coronavirus linked to travel do so 5 days after arriving back in Wales. Now, I believe, as I've said many times, that if ever there was a year to holiday at home and to enjoy everything that the wonders of Wales has to offer, then this surely is the year to do just that. So as a result of all the changes that have been announced today, on Monday, we will take another significant set of steps towards a more normal life. We are only able to do this because of everything we all continue to do. Those are the efforts that are keeping Wales safe and helping us to control this awful virus. Thank you all again for all the help that you are providing. Together, we continue to make that difference, and together, we can put this pandemic behind us. Diolch o galon I chi gyd. I'll now, as usual, turn to take questions from journalists, and all the answers will be broadcast live on the Welsh Government's social media channels. And first this afternoon is Sarah Dickens from BBC Wales.
As Minister, thank you very much indeed. And can we have your answers in English and Welsh, please? So you talk about your concern for new variants, especially the Indian variants. You say 26 cases in Wales now. Do you know how they're arriving here? How concerned are you? And really, what action might you consider because of that?
Well, Sarah, we have, as you say, 26 cases that we know of the India variant in Wales. They are almost entirely the result of international travel. So people coming back to Wales from overseas. They are all cases that are being very carefully monitored by local public health teams. And all the information I have had is that the individuals involved are following all the advice that they are required to follow, self-isolating, their household self-isolating and so on. And the advice I have is not that we need to be overly concerned about the position in Wales at the moment. It is more that the significant spread of that India variant across our border is something that we need to understand better, get better advice about. There is a significant cluster of that variant in the northwest of England, and we know that the border between the northeast of Wales and the northwest of England is a very porous one, so we're keeping a particular watch on developments there. Should it be necessary to take action in Wales, then of course we will do so. And we do have vaccination as a new tool at our disposal compared to this time last year. As you've seen, the levels of vaccination, first and second doses, amongst the most vulnerable population in Wales are already extraordinarily good. But if there's more we need to do, and if we need to calibrate our vaccination programme so that it provides even more defence to us in Wales, then of course, if we get that advice, we will follow it. So just either way, pobl yng Nghymru sy'n dioddau o'r y variant newydd sydd wedi dod o India, a ran fwyaf fawr ohonyn nhw wedi dod nôl o tramor gyda'r y virus i Gymru. A ni'n gwybod ble mae pobl yn byw ac mae pobl lleol yn y maes iechyd y cyhoedd yn delio gyda'r bobl, a popeth dwi wedi clywed yw mae pobl yn dilyn popeth ni'n eisiau nhw dilyn, a does dim rhaid i ni becso gormod am y sefyllfa heddi yma yng Nghymru. A problem yw beth sy'n digwydd dros y ffin, ble mae'r nifer o bobl sy'n yn dioddau o'r y variant newydd yn cynyddu yn eitha gyflym. So mae lot o pethau i ni dysgu, i cael fwy o gwybodaeth, i bydd yn fwy sicr am sut mae'r variant newydd yn lledaenu ac sut mae'r raglen brechiad yn gallu helpu ni i delio gyda'r unrhyw problemau newydd sy'n mynd i codi. Ni'n cymryd cyngor sage, y pwyllgor ar lefel Deyrnas Unedig, a cyngor ni'n cael gyda'r pobl lleol sy'n helpu ni, ac fel ni wedi wneud bob tro yn y pandemig, ni'n mynd ar ôl y cyngor ni'n mynd i dderbyn.
And you talk about your concern, but given that, and given that we have seen in the last year variants that originally came through international travel spreading within the UK, you know, you're announcing today a move to level 2. What is the chance, do you think, of the developing variants in parts or other parts of the UK, the Indian variant, meaning that you might have to delay any moves to level 1?
Well, of course, that is a genuine consideration. It's why we never rush our fences here in Wales. What I've said is that at the next 3-week review, if things continue to be as good as they are in Wales today, and we continue to make progress in the right direction, then we would be in a position to move to level 1 restrictions, which would restore even further freedoms. And of course, that is what we would like to do. But we will only make those decisions in the light of the public health position in 3 weeks' time. And we have certainly learnt, haven't we, how across the world a relatively positive position can turn much more difficult in just a matter of weeks. So it's why I've always been anxious not to set out too far into the future the sort of definitive set of dates that some other countries have chosen to follow, because the situation can move so rapidly that some of those dates can then just turn out not to be achievable. For the moment, we will continue to work with the different sectors concerned to a level 1 set of restrictions at the beginning of June, but we'll only be able to deliver that if the situation we are currently in continues to be as good as it is today. So, am y dyfodol, dwi wedi ddweud heddi ar ddechrau mis Mehefin, os allwn ni'n eisiau symud i'r lefel 1 yma yng Nghymru, bydd hwnna'n dibynnu yn llwyr am y cyd-destun sy'n wynebu ni ar diwedd mis Mai ar ddechrau mis Mehefin. Bob tro, ni'n wedi wneud pethau yn yr un ffordd, un cam ar y tro, aros I weld y sefyllfa sydd wynebu ni ar y pryd, a bydd hwnna beth yn ni'n mynd I wneud yn mis Mehefin hefyd. Y gobaith yw allwn ni symud I llacio cyfyngiadau unwaith eto, ond bydd hwnna yn dibynnu ar y cyd-destun yn mis Mehefin, a bydd hwnna yn dibynnu ar pethau ni wedi bod yn siarad amdano hefyd heddi gyda'r variants newydd a pethau sy'n digwydd nid just yma yng Nghymru, ond ledled y Dynes Unedig ac I gweud y gwir yn ledled y byd. Sarah, thank you very much. Over to Adrian Masters at ITV Wales.
Thank you, First Minister. Could you give us, please, more details on indoor hospitality and entertainment venues? We've been speaking to entertainers and people in that sector who say that, while they're pleased that the venues are opening, they're not sure whether they'll be able to perform in them. So can you say whether artists can play music, or singers can sing, or entertainers can do their job, can do their jobs in those venues?
Yes, there will be opportunities for those artists to return to work. Of course, that will depend upon the nature of the venue itself, and all of that will have to be negotiated in the specific circumstances of the different theatres, concerts, halls and so on that we have in Wales. We know we've got many different shapes and sizes, and what is possible in one venue will not be possible in every venue. So I don't think I can offer a general rule. The guidance will be available through the Welsh Government. The safeguards will need to be put in place. But the fact that as of Monday, these venues will now be able to begin to reopen means that that journey will start, and the negotiations and discussions between performers and artists and those people who are responsible for the safe running of those venues will be able to begin in earnest.
Thank you. And I wonder as well if you could say a bit more about overseas holidays. Well, I heard what you had to say about advising people to stay at home and enjoy the wonders of Wales. There will be some people, some families who will have a holiday booked or will be wanting to go overseas, and it won't be illegal for them to do that, but you've advised against that. So should they feel guilty, or should they be made to feel guilty if they take a holiday overseas, one that might be very well earned?
No, I've no wish to make anybody feel guilty about decisions that they make. All I want is that people make those decisions with their eyes open, that they think of their own safety and the safety of others in doing so, that they are clear as to the rules and what will be required of them if they choose to visit, for example, a country where coronavirus is still in circulation, that they alert themselves to the conditions that apply in any country. We have put Portugal on the green list, as has England and Scotland, but people will have seen that yesterday the government in Portugal extended what they call the current state of calamity to the end of May. So what I'm trying to do today is to make sure that people who make the decision, as they will be able to travel abroad, not for essential reasons, but for recreational reasons, do it in full possession of the facts and the consequences of that decision. And as I say, for anybody who is still making their mind up, I want to be clear that the advice of the Welsh Government is that this is the year to holiday at home and to take advantage of all the many, many fantastic opportunities there are to explore our own country and thus avoid the risks of re-importing the virus again into Wales. Adrian, thank you very much indeed. Over to Sam Coates at Sky News.
First Minister, with so many of the Welsh population vaccinated, can you spell out exactly why this Indian variant is worrying? Is it because of the impact of it on people in their 20s and 30s who haven't been jabbed, or because it has the potential to infect those who've been vaccinated, or the potential impact on the NHS? What are the scientists telling you about the differences between the Indian variant and the variants that have come before?
Yeah, thank you, Sam. So I think the main state of play in the advice we are getting at the moment is that there are things about the new Indian variant that we don't know enough about. So it may be, and there is some preliminary evidence, that it spreads faster than the Kent variant and might supplant it. So that's the first thing. We don't know enough to be sure about that, but the uncertainty is enough to make us pause and want to get better information. There's then the issue as to whether or not the vaccination programs that we have will be as effective in dealing with the Indian variant as it is against the current variants. And again, it's not that we know that vaccination won't be, it's just that there is more evidence needed and more questions to answer. So our approach has always been a precautionary approach, where there are significant unanswered questions about transmissibility and infectivity. Then our view is that we should pause, get that evidence, and then make decisions rather than make decisions in hope.
Is there any evidence that those in the unvaccinated age ranges, the people in their 20s and their 30s, are actually hit harder by the Indian variant?
No, I don't know of any evidence of that sort. Here in Wales, as you'd have heard me say, we already have 78% of people in their 40s vaccinated, 56% of people in their 30s vaccinated, 37% of people in their 20s vaccinated, and our current plan is to accelerate first doses of vaccination for people in those age ranges. Because in any age range, from whatever the risk may be, the more people we can get vaccinated, the better protected they are, and then the better protected the whole of the population will be. Sam, thank you very much indeed. Over to Will Hayward at Wales Online.
Thank you, First Minister. Last autumn, when there were spikes in the northwest of England, you made loud calls for the Prime Minister to stop travel from those areas. Given that you have said that the Kent variant entered Wales through the northwest of England, and given that Bolton appears to have significant numbers of the Indian variant, are you going to be making appeals to the Prime Minister to stop travel from those areas? And if not, what's different this time? And what powers do you have to protect Wales if there are spikes in England, if you don't feel the UK government has gone far enough?
Well, first of all, I don't intend to do that at the moment, but I don't rule out doing it as evidence emerges. Were we to need to take action ourselves, we have demonstrated during the whole of the coronavirus crisis that we are prepared to restrict travel in and out of Wales, where we know that that is in the best interests of Wales. And the difference between now and back in the autumn is that then we had a clearly identified problem that we knew about, and at the moment we have an emerging issue that none of us have sufficient sense of what lies behind it and what its future might hold to take action as drastic as preventing people from travelling from one part of the United Kingdom to another.
Thank you. Modelling from the government's SAGE advisory group by the University of Warwick has suggested that unless the Indian variant is less than 20% more transmissible than the Kent variant, there will be a significant risk to the NHS. If all restrictions are lifted as planned next month, a variant that is 40% more transmissible is likely to create a peak of 60,000 hospitalisations a day in August, and that will far exceed the peak in January we saw. If this is the case, and given this potential modelling, how likely do you think future lockdowns are in Wales?
Well, our own modelling, the modelling carried out by Swansea University, which is the modelling that we rely on most in Wales, we are still expecting a third wave of coronavirus later in the summer, but we don't expect it to be of a magnitude that would cause the same levels of pressure on the NHS that we've seen at the turn of this year, and it wouldn't be of a sort or a level that would require us to go back into lockdowns of the very blunt nature that we needed in the spring of 2020 and over Christmas and into the new year. Now, I have never myself used the word irreversible to talk about the path that we are on out of coronavirus. And I've said already today that the Welsh Government will continue to approach the whole business of unlocking in the careful, cautious, step-by-step way. And if the evidence changes and new risks emerge that we need to take into account, then that will have an impact on our ability to go on lifting restrictions. And the impact on our NHS and the ability of the NHS to do what it is now resuming in very significant measure, treating non-coronavirus patients, beginning to make inroads into people who have been waiting because of coronavirus, that will be very much at the top of our thinking as we take those difficult decisions about what lies beyond the next 3 weeks and the announcements that I've already made.
Thank you.
Well, thank you. Draw I Adam Hale, PA.
You've said that you're pausing easing more restrictions in Wales to wait for reports from SAGE and your own technical advisory cell report back about their findings about the Indian variant. Would the fact of this strain being a more transmissible one alter your plans to move between Wales's alert levels, or would you actually have to see that translates into a spike in transmissions?
Well, Adam, as you say, there were a couple of things that the Cabinet were considering alongside the announcements we've already made for the 17th of May. And we have paused those because we didn't have sufficient information about the new India variant. We will wait to see what the advice is. If the advice says that it's still sufficiently good to be able to move ahead, we'll move ahead. The advice is we need to continue to pause, we'll continue to pause. I simply don't think we know enough at this point to be able to give anybody a definitive sense of how that variant will alter our decision making, other than in that general sense. That if it does become a matter of concern, that will inevitably slow down our ability to go on lifting restrictions if it turns out that the India variant can be successfully managed and it doesn't have an impact on community transmission and flow into our hospitals, then we will be able to continue on the path that we've outlined today, moving in June to lighten restrictions still further.
Thank you. Travelling abroad for anything other than essential reasons hasn't been legal here in Wales or across the UK for a number of months. Obviously on Monday that changes for specific countries. Given that's the case and that 26 people with the Indian variants associated with travel here in Wales, associated with travel to India in some cases, people will be asking just how the variant is in Wales when travel has been limited. What's your understanding of the reasons behind these people's international travel over the past weeks or so?
Well, people have still been able to travel in and out of the United Kingdom for essential reasons. You haven't been able to travel for recreational reasons, but people who have a necessary journey because of important work commitments or because there is a family emergency, for example, travel of that sort has still been possible. So that is how you see people returning to the United Kingdom from other parts of the world, and sometimes, still rarely, let's be clear, still rarely bringing the virus with them. It's because while most travel has not been legal, essential travel has continued. Adam, diolch yn fawr. Over to Dan Bevan at LBC.
Thank you very much, First Minister. Good afternoon to you. Despite the concerns that you've raised today over the Indian variant, as have others over the last few weeks, there is still talk that the legal requirements for social distancing and also for mask wearing in England is to be removed on the 21st of June. Now, Is that something that you're having to consider yourself? And if it isn't, do you fear that your hand might be forced for the sake of continuity as it has in other previous measures?
Well, we will look carefully at the social distancing review being carried out by the UK government as far as England is concerned. But anybody who is interested in it will be able to read the Chief Medical Officer's report, which we publish alongside our decisions every 3 weeks. And in Dr. Atherton's report, which we'll publish today, you will see that he continues to argue that we will need those measures that we have got used to in our own lives, whether that's hand washing, mask wearing, or maintaining a social distance, well into the summer and beyond this year. So we will obviously listen very carefully and follow the advice that our Chief Medical Officer provides us. And if it is different to the advice that is available in England, then we will do something different in Wales. If we think that the evidence tells us that that is a better way of keeping people in Wales safe.
Thank you. And turning to international travel, can you give us a bit more information on these paper vaccine passports? What will they look like? What will be on them? How can you get them? And why can't we use the NHS app as in England? And just one other, if I don't mind, still on international travel, what does this mean for the future of Cardiff Airport?
Let me try and make sure I've got those in my mind in order, Dan. I've had a chance to discuss the certificate with other First Ministers and Cabinet Ministers in the UK. It will be a common certificate across the United Kingdom, I hope, which will bear the logos of all 4 NHS systems in the UK. It is being very carefully designed to make sure that it is unique to the user, that it cannot be photocopied, that it cannot be replicated just by printing one offline, to make sure that people have confidence that the certificate really does mean something. And a lot of work, and I think successful work, has been done to get us to that position. In Wales, it will be bilingual, of course. How people will get it in the short run is likely to be through making a phone call into one of our Test, Trace, Protect teams, who will have the capacity to be able to take the information from the individual, get the certificate printed and made available to them. The app that will be available in England will be available in Wales. There's likely to be around a 4-week gap before the 2 systems can, in that sort of technical, plumbing type way, be able to talk properly to one another to make sure people's data is safe and that the data about someone who lives in Wales ends up in their NHS record here in Wales. Our systems are relatively similar, and that's why it will only take a matter of weeks in order to be able to get that technical detail in place. I think it's likely to be considerably longer in Northern Ireland and Scotland before that can happen, because their systems are considerably more different. For Cardiff Airport will follow the same rules and reopening of foreign travel as anywhere else. It will be able to hold flights now to green country destinations without people having to self-isolate on return, but with the extra help that we intend to offer people returning from some of those green list countries, where the difference between them and amber list countries was more marginal. Dan, thank you. Howell Griffith at BBC News, please.
And on foreign travel, you know that there'll be thousands of people in Wales with foreign holidays booked for this summer. It won't be illegal for them to take them. Will it be irresponsible for them to take them? And for those thousands travelling to either Azerbaijan or Rome to support Wales in the Euros, is travelling to support the Welsh national football team in the Euros deemed essential in your book?
I think in both instances, it is for individuals to weigh up for themselves the risks they are running and the choices they are making. It's not for me to make judgments about that. It's for me to be clear with them about what the rules are, what the risks are, what the consequences are for people when they return to Wales, and then to say to people, when you've got the information that you need, please think it through, think of your own safety, think of other people's safety, then make your decision. And if your decision is to travel, whether that is to go to a football game or for any other purpose, please just be sure that you have factored into that decision the consequences that there will be there for you when you return to the UK, whether that is a quarantine regime, whether that is a testing regime. Go into this with your eyes open and with using the lens of your own safety and that of others as the primary test that you apply to the decisions you're making.
There is an indicative date in other parts of the UK for lifting all social contact limits. Do you foresee being able to give a date after future reviews? And in particular, do you think the requirement or request for people to work from home will be lifted this year in Wales?
Well, I think that working from home continues to be a major contribution to keeping Wales safe. As the year goes on, I think we will see more blended approaches with people spending some time back in offices and other work locations and some of the week working from home. You know that the Welsh Government has an ambition that well beyond coronavirus, 30% of people at any one time are able to work remotely at remote working hubs that we're establishing in different parts of Wales or from their own homes. And that's because there are many benefits. Benefits to the individual, benefits in terms of equality, but also benefits in terms of the environment from shifting some of the working patterns that we have seen and that were just entirely taken for granted before coronavirus hit us. We've learnt a lot about how we can work successfully in more flexible ways. And my hope is that we will learn those lessons and apply them here in Wales. As to whether or not we will give a date for the very end of all restrictions, as I've said, I don't want to over-anticipate how quickly we can get to that in Wales. And the events of the last 24 hours and the concerns we've been talking about, I think, help to illustrate why we've gone about things in that way. I've set out what will happen in the next 3 weeks. I've given an indication of what we hope will happen in the 3 weeks after that. And then as we get closer, as we move further down the calendar of this year, then of course we will continue to give people in Wales as good an indication as we can of what may follow. Hywel, diolch yn fawr. Over to Steve Bagnall at the Daily Post.
Thank you, First Minister. I appreciate you have covered this in previous questions regarding the India variant, but just to be absolutely clear, Wales could reintroduce a cross-border ban from high incidence areas such as the northwest of England if needed. And if so, is there a threshold in a rising cases in these areas that would have to be reached for such an action to be activated?
Look, just be absolutely clear, there are no plans to do that. There's been no discussion of doing that. It would be a very significant step to take. But as ever, what I always say to people in Wales is we rule nothing out. If it became necessary in order to protect the health of people in Wales, to limit people's ability to travel across the border, then we wouldn't shrink from doing that if we knew that that was necessary. But there's no indication at all at this point that it is something that we are going to have to do.
Thank you. Test events have been planned in Wales to pilot larger gatherings in stadiums, theatres and festivals. They're in the south and there are none in the north. Is there any reason for this? And are there plans to pilot similar events in other parts of Wales, including the north?
Yeah, no, there's no geographical reason why the events are where they were. They were in different parts of Wales when we had our pilot programme back in August and September. I am sure that if Wrexham reach the playoffs, then there will be a pilot event where people will be able to attend the home leg of that. So in that sense, there would be an event in North Wales, and I hope very much, and my colleague Leslie Griffiths wouldn't forgive me if I didn't say that I hope very much that that will indeed be the case in Wrexham. Steve, thank you. Over to Nicholas Thomas at the National.
Thank you very much, First Minister. You've made some changes to your government this week, including appointing a new health minister. Was it time for a different approach to the way the Welsh Government dealt with the pandemic?
No, it's not an indication at all of a difference in the approach. The approach will remain as it has been throughout. Careful, cautious, step by step, guided always by the best advice that is available to us. There's been an election. There is a new 5-year term ahead of us. There will be new challenges in rebuilding our economy, in rebuilding our health service, and in Wales playing its part in that other great crisis of our time, the loss of biodiversity and climate change. And the decisions about cabinet portfolios was very much made through that lens of wanting to create that ambitious future for Wales through the remainder of coronavirus and then beyond.
Thank you very much. The case rate in Newport at the moment is higher than any other local authority area in Wales, and it has been for several weeks. Do you have any indications of what's driving that?
Yes, we do. And the advice that I have had is that the numbers in Newport are explained by very local outbreaks. For example, in a workplace or in a care home, or because of, in one case, some illegal gatherings. All of them are known to the local public health authorities. All of them are being successfully followed up. And the advice I have is that those numbers in Newport need not be a cause of more general concern to us because they are properly understood and receiving a response from those local public health teams. Nicholas, thank you very much indeed. Back up to Wrexham and Rob Taylor.
Good afternoon. We're seeing great work by vaccination centre staff with spares, and the spares of spares lists populated often at short notice to make sure nothing's wasted. It appears that numbers of those who have the flexibility to attend specific appointments could be reducing, and now that there are increasing numbers of no-shows for whatever reason. Is this a growing problem, and what's the solution? And could we be heading towards general open vaccination invites?
You're right, Rob, that the system is having to respond very flexibly to make sure that we make the maximum use of the appointments that are available. And because of the advice of the JCVI, which of course we follow, that Pfizer vaccine should be used primarily now for people in younger age ranges, that does come with greater challenges about wastage. So that's why you see that greater flexibility and lists of people being called at short notice. The very good news is that we're getting a very strong response for people in younger age ranges coming forward for vaccination. I met a whole range of people in their 20s on the doorstep over the last 5 weeks telling me that they've been called for their first dose and they were amazed to be called so early for it here in Wales. So that's the good news. We do need to continue, though, to find imaginative and inventive ways of offering vaccination in a way that meets people's circumstances. So the more you go down the age ranges, the more you are dealing proportionately with people who are in work. And sometimes people are in work where it is not easy to get released to go for vaccination. So we are having to recalibrate the programme to make sure that the offer we make suits the circumstances of the people we are trying to bring into the system. Whether that will result in open vaccination clinics, I've not seen advice on that, but I'm quite sure that the people who have been so successful in the way that they've run the programme so far will be thinking about all the different ways in which we continue to make the maximum use of the supply that we have and make the programme as available and as accessible to as many people as possible.
Thank you. And earlier you said you could look at calibrating vaccination programmes to help mitigate the issues around the Indian variant. Surge vaccinations have been suggested to deal with the issues in Blackburn and Bolton. However, there appears to be debate and therefore a lag in deciding if that's appropriate over the border. Is that the kind of action you meant? And are there plans in place for that as a targeted response? And would you give decision-making freedom, I suppose, to health boards and local authorities?
I think there are two ways in which vaccination could be calibrated to deal with the sort of circumstances we're seeing across the border. First is that you could, as you probably heard, calibrate the vaccination so you do more second doses of more vulnerable people. Now, if that were necessary in Wales, we would be starting from a very good platform because, as you have seen, people over 70 and 80, over 90% of them have already had their second dose of the vaccination. Over 90% of care home residents have had their second dose as well. So it would be possible to do more, lower down the age ranges for more vulnerable people. So that's one possibility. And then the second possibility is, as you say, to do a concentrated vaccination effort in a particular geographical area were there to be a surge of cases there. We absolutely don't rule either of those things out in Wales. If they were necessary, we would do it in partnership as we try to do everything. There would be advice available nationally. It would be delivered locally using all that local knowledge and experience that all our health boards now have of delivering vaccination successfully. So we didn't have vaccination this time last year, so it is a new tool that we can try and deploy to deal with new and emerging circumstances, and we definitely would be considering doing that in Wales were we to need to, with only 26 cases at the moment of the Indian variant and no geographical concentration of them. Probably neither of those things is currently immediately on the cards here, but we'll plan on the basis that we might need to do so. Rob, thank you very much. Over to Nathan Shoesmith at the Speaker.
Thank you, First Minister. Good afternoon. We've just had confirmation that UK tourists will be able to travel to Portugal from Monday. There was some uncertainty about that. With that and the other easing from Monday, are you confident that enough measures are in place both at the border and in terms of policing people, quarantining from the red and amber list countries so that there isn't too much spread of the virus?
Well, I think it's a very important issue that we need to continue to attend to very carefully. So if people are to travel to other parts of the world and there is a regime in place to make sure that they can properly be followed up and helped on their return, we do need to make sure that that system is working effectively. It relies on what's called a passenger locator form and then the evidence from that form being quickly transferred to the part of the world that people are returning to. So we have worked with colleagues in the UK government to make sure that that system is working effectively. As more people travel, if that is what happens, then that system will come under more pressure. And therefore, it is important. At the moment, I don't want to sound critical of it, but I do think that it is going to be an increasingly important part of our defence against the reimportation of the virus, and therefore it will need to be kept very, very carefully under review to make sure that it is standing up to the pressure it may come under.
Thank you. And you've talked about SARS vaccinations. Are there the same sort of capacities in Wales as there are across the border for surge testing in Wales if it becomes necessary to look for the new variant? And would you consider local lockdowns in the coming weeks and months if there are certain areas with the variant?
We have surge capacity in Wales. We have used it in parts of Wales already. We take a slightly different approach to the UK government in doing so because our surge capacity has generally been more targeted and more carried out in partnership with local authorities and local public health teams when we do it. But we do have that capacity. We've tried it. It's tested. It has worked where we have needed it. We don't have plans for local lockdowns. We've so far managed to come out of this experience on a national all-Wales basis. That is how we would prefer to continue. But if there were to be particular issues in particular areas that required a local response, then of course, in partnership with those local players, that is what we would seek to agree and to implement. Nathan, thank you to Andrew Nuttall at the Leader.
Thank you, Minister. As has been mentioned today, lots of sort of towns, especially here on our North Wales coast, will rely on the tourism industry to thrive and sort of bring in a large chunk of their own economy. With the news that the tourism industry will start to reopen from next week, do you anticipate that the summer holidays will help businesses recover that have missed out over the trading periods of half-term breaks, bank holidays, and more recently the Easter period?
Yes, thank you, Andrew. So, just to be fair about it, tourism isn't starting in Wales on Monday because self-contained accommodation has been open in Wales since the start of April, so that the tourism industry could use that very important Easter period, and Wales was the only part of the UK where tourism opened at that point. So, look, I think tourism has got off to a very good start in Wales this year. Once again, I think the industry has demonstrated the careful way in which it has gone about reopening, taking those local communities with them where people haven't seen visitors for many months, and now there will be a further reopening of that industry. I hope this will be a good year for the tourism industry in Wales. I hope that more people thinking of how they will spend their holidays will decide to holiday at home and use the fantastic opportunities that are available to them right across the whole of North Wales, but in every other part of Wales as well.
Thank you. And we've also seen today future reviews on things such as nightclubs and live music venues. It will remain closed throughout the lockdown period and remain largely dependent on the younger cohort vaccination from 18 up to, I believe, 39 over two different groups. And you've been reported as saying that today. In your opinion, do you believe that this is something that will cause an issue, or are you seeing levels of vaccination uptake as quite high in younger people?
Yeah, well, look, I think we're very encouraged by the take-up of vaccination amongst younger age groups. There's always been a bit of a concern that as you move down the age groups, maybe fewer people would come forward and younger people would feel that they didn't need the protection of it. In practice, that is not turning out so far to be the issue that we feared it might. And you've probably seen some reports from health boards today saying, young people are coming forward in very strong numbers. And the figures that I quoted earlier of the number of people, the percentage of people in their 20s who've already received vaccination in Wales are, I think, very, very encouraging. Provided we can sustain that and provided the general rates of coronavirus remain low, then we will be getting closer to the time where some of those venues will be able to reopen and reopen safely in Wales. Over to Alan Evans at Llanelli Online.
Ongyfarchiadau, congratulations on being selected to lead Wales once more. I must be one of the only people in Carmarthenshire not to have seen you in recent weeks. First question for you is, the Welsh Government has provided one of the most generous packages of financial aid of any of the UK governments. However, as you may or may not be aware, what you give in one hand is being taken away in the other hand by local and county councils by way of huge rises in precepts and council tax, while at the same time reducing services, leaving communities facing further hardships. In Pembrey and Buryport, for instance, over the last 6 years, residents claim they've seen an increase of 65.25%, over 6 times the rate of inflation. Is it not time for the Welsh Government to step in and to sort these money grabbers out to ensure the work and targets to reduce child poverty in Wales is actually something that could succeed?
Well, Alan, diolch yn fawr, and I very much enjoyed my many visits to Llanelli over the last 5 weeks, and very pleased indeed to see the results of all those efforts. One of the real priorities of the next term will be to make council tax fairer here in Wales. I don't probably sign up to the very end of your question, because one of the reasons why councils need to raise funds is to help them in the things that they do to tackle child poverty. So everything that our local authorities do in terms of Flying Start and Families First and Team Around the Family and all of those services are local authority provided services. And to fund those, they rely in part on the money that they raise through the council tax and the local precept. So I don't think it's that they raise money for no reason. They generally raise money for very good reasons, but the fairness of the system is not as we would like it to be, and it will be one of the early priorities for this term to use all the research that we carried out in the last 5 years to find practical ways in which we can make paying for those very necessary services fairer than it otherwise would be.
Thank you. I do understand, but it is a huge rise in one of those councils, and it will affect a lot of people. Opportunity knocked for you as a result of the pandemic, and the clapometer declared you as the outright winner. The Welsh public will be hoping that you have more than one tune in your repertoire in the coming term of office as First Minister. Are we going to be able to change opportunity knocks into question time on a wider range of issues? And would the First Minister advocate that the CEOs of local authorities place themselves in a similarly exposed position in front of the press and taxpayers to answer questions on major issues affecting communities?
Well, you have to be of a certain age, Alan, to get the many cultural references in that question. So I've no ambition to be the Huey Green of the Welsh Government, but I do have an ambition to be able to move back to the sort of press conferences we previously used to hold, which were not simply coronavirus press conferences, but allowed people to ask questions on all the different things that I want the Welsh Government to concentrate upon in the next 5 years. So definitely more than just the coronavirus tune, all those other things in the economy, in education, in that really important agenda of climate change that I want this government to be able to focus on. I agree with the second part of your question, other than in one point of detail. I don't think it's chief executive officers that should be out there on the front line answering questions so much as leaders of councils and people who are elected. You know, in the end, those are the people who have to be answerable for the decisions that are made at local authority and town council level, just as I have to be answerable for things that the Welsh Government does. And I do think, absolutely, and our new local government legislation will place new duties on council leaders to make sure that they are available to their local populations and answerable for the decisions that they make on their behalf. Diolch yn fawr. Finally, for this afternoon, over to Tom Magna at Carers World Live.
Thank you very much indeed. In accepting reappointment as First Minister, you said nobody will be left behind in your government's plans for recovery from COVID-19. What perceived shortcoming caused you to make that promise? Is it relating to unpaid carers? I suppose, in essence, did you mean what you said?
Well, what lay behind it was not just a specific group in the population, but a recognition that Wales has become, alongside the rest of the United Kingdom, far too unequal a place, where the chances of people being able to use their talents and make their contribution to Wales is too often affected by the circumstances they face early in life and in other ways too. So when I talk about nobody being held back and nobody being left behind, it is part of this government's commitment to do everything we can to fulfil the obligation of the Wellbeing of Future Generations Act, which is to make, to move towards a more equal Wales, because countries that are more equal are more inclusive of their populations and make sure that everybody benefits by using the talents that are available to all. And that, of course, would include the huge contribution that unpaid carers make here in Wales.
Before the election, you called for unpaid carers to prove who they are when it comes to vaccination. What proof can you give our audience that you and your government will take certain and urgent action to prioritise improving the daily lives of unpaid carers?
What I asked people to do before the election was to make sure that unpaid carers got to the front of the queue, and that people who were simply claiming to be that didn't prevent genuine unpaid carers from getting the service that they required. That's what we were doing. We weren't asking people to prove they were carers for the sake of it. It was to protect their interests and to make sure that they genuinely did get priority in the way that we wanted them to. Our manifesto, the Labour manifesto, as I'm sure you know, sets out a series of commitments to improve the lives of unpaid carers, whether that be through additional funds that we want to provide, whether that be through improved respite arrangements that we know make a difference to the lives of many unpaid carers. I was very glad to be able to reappoint Julie Morgan to the post of Deputy Minister for Social Services, who I know has worked so closely with carers organisations here in Wales. And we'll now want to use that platform and the new mandate we have to press ahead with the commitments that we have made and hope to see those commitments make a genuine difference in the lives of people who we absolutely recognise for everything that they have done and want to go on supporting them to enable them to do the things that we know they give so generously and are so committed to providing in the lives of other people. Diolch yn fawr. Thank you all very much indeed.